Welcome to How to Become the Elite Massage Therapist Everybody is Lining Up to See. We're going to talk about the 3 secrets to fill your appointment book with ease, increase your income while reducing your effort, and have happy, satisfied clients coming back for more. Let's look at some of the reasons why we became massage therapists. These are mine. Maybe they ring true for you. So maybe you feel like you are a natural caregiver and you love helping people. You're probably fascinated with learning about the human body. I know that I am. You probably love the art and intuitive nature of massage therapy. And being a massage therapist really taps into your natural talents. And if you're like me, you're a self-driven person and you want to earn an income doing something that you're passionate about. Let's take a quick look at massage therapy stats. Massage therapy is estimated to be a $16 billion per year industry. And the survey data in the US shows that almost 60 million American adults got at least one massage last year. So that's 24% of the population. And I'm sure that this is very similar with the Canadian population. So where are all the clients? How many of you thought that once you completed your basic training that clients would just flow to you with ease and so would the money? Well, that is possible, and that's what today's masterclass is all about. But how many of you seem to constantly be looking for new clients or have trouble consistently rebooking clients and getting new referrals? So are some of these struggles true for you? Do you feel like you're struggling to build a steady stream of satisfied clients and make the income that you thought you would? This waiting room is beautiful, but we don't want our waiting rooms to look empty. Or maybe you are worried about hurting yourself and not lasting long in this industry. Massage therapy is a very physical, demanding career, and we need to make sure that we take care of our bodies first so that we can last in this industry. Or you might just not feel confident in your ability to treat all the different problems that show up on your treatment table. You might feel like you need help, but you're not even sure where to go to get it. Or you might be frustrated that you spent thousands of dollars on your basic training and now you're afraid of becoming a statistic and not lasting long in this industry. Well, when I started out, I was right there too, and I, of course, had many of those same fears. But today, I really want to speak to you about how I can help you stand out from the crowd and be the therapist that clients are lining up to see. We don't want to have any of these struggles or frustrations that I just talked about. One thing I know for sure is you cannot become who you want to be by remaining who you are. I love this quote. And first of all, I want to thank you for being here today and being the kind of person that takes action and shows up for these types of online trainings. A lot of people register, sign up for the training, and then don't show up. So first of all, give yourself a pat on the back for showing up for yourself this morning. And I want to thank you so much for being here. I feel truly blessed to be able to be here with you today. Especially people from all over the world, and be here to serve and support you. So thank you very much for being here. So before we go any further, I should probably just introduce myself to you to give you a little context around why you should even be here listening to me today. So I've been practicing and teaching therapeutic massage for 25 plus years. And I've really seen firsthand how therapeutic massage can have such a profound effect on our clients' health and well-being. I didn't start out as a massage therapist, but I've always really been fascinated with how the human body works. I started out as a phys ed teacher, and I taught high school phys ed and health for about 10 years, went back to university and got my master's degree in kinesiology as well. And then I wasn't really sure what I wanted to do for a while. I really loved teaching, but I knew that teaching in high school just wasn't exactly what I wanted to do. So I ended up going and teaching at a massage therapy clinic in Red Deer, Alberta, where I live. And I was teaching the anatomy and physiology. It wasn't long after starting to teach there that the experienced school owner kind of decided to take me under his wing. And I became really immersed into learning everything I could about massage therapy. And it was then that I began to realize that everything that I had done to this point in my life, all of my education and training in physical education and all the anatomy and physiology, had led me into the massage therapy industry. So, long story short, I passed my provincial board exams and my new career as a registered massage therapist was born. I worked in the school clinic for about a year, and then I decided that I wanted to open my own practice. And I opened a clinic specializing in therapeutic massage and rehabilitative exercise programs. It wasn't long once I got going into my practice that my clientele really began to grow. And I realized that I was doing something different than most massage therapists. I seemed to be giving my clients results unlike they'd ever had before with other therapists. So as the clientele kept growing, I realized that I needed to hire other people to work with me. And then it was kind of a struggle to find therapists who provided the same type of treatment that I was. So I looked for like-minded people that really wanted to learn from me. And I taught them a lot of the techniques and skills that I was using, and they all became part of my team. So again, to make a fairly long story short, I ended up having a very thriving, successful clinical practice for over 16 years in Red Deer, and I employed several different therapists that really enjoyed great careers with me as well. So then, as I was going along in the clinic, I really loved doing massage therapy and seeing the effects that it had over my clients, but I also kind of realized that I really needed to get back into my superpower. My superpower, of course, is teaching. So I decided at that point to sell my clinic after 16 years, and I started my training company called Perfect Balance. And Perfect Balance really became a perfect marriage between my education and experience as a teacher and my passion and expertise as a massage therapist. So enough about me. That's a little bit of my history, but the goal of this masterclass is to show you how to dramatically increase your income, efficiency, and effectiveness as a massage therapist while reducing your repetitive strain. My mission really is to empower therapists just like you to unlock your true potential and create more impact and more income than you ever thought possible. I often work with registered and licensed massage therapists who are struggling to build a steady stream of satisfied clients, and they're not making the income that they thought they would. But I really know from my clinical experience and my education and training what works and what doesn't work, and I'm passionate about sharing that all with you. I'd love to help you become the go-to expert and fill your appointment book with ease. And if you already are that go-to expert, I hope to inspire you and open up some different and new ways of doing things that might even propel you forward even a little bit more. I'd like to introduce you to one of my successful Tissue Talk graduates, Mandy Schuler. And she says, I feel truly blessed to have found you and your advanced training programs. I feel like I'm looking through new eyes, and I'm so much more confident in my profession. Your techniques have absolutely given me the skills I need to truly assist my clients, and for that, I am forever grateful. So this masterclass is designed to reveal the 3 secrets to you to elevate your expertise as a healthcare professional, build a sustainable business with a consistent income, and develop intelligent and intuitive skills to talk to the tissues. And I'm going to tell you lots more about that as we go along. Okay, who's ready to get into secret number 1? Maybe put in the chat box, yay, I'm ready to get into secret number 1. Yay, yay, yay. And if you have a question, you can just type it in the chat box there, and Cindy will do her best to answer you. Secret number 1 is all about the one thing that causes many massage therapists to fail and never achieve their full potential, even when they've graduated from a reputable massage therapy school. So why is it that some massage therapists have thriving practices where others continue to struggle? And what will set you apart from the rest? Well, statistically speaking, the sad reality is that many therapists sustain only a limited clientele or drop out of our profession in their first 5 years. And 50% of those dropouts are often due to some kind of repetitive strain injury from performing treatment. The other reasons for dropout are mental and emotional burnout, unrealistic expectations, lack of confidence. I've definitely found is a big one amongst a lot of therapists that I've worked with over the years, and lack of business experience is a big one as well. So, unfortunately, 50% of therapists earn less than $30,000 a year. But there's lots of good news too. Being a massage therapist can be very fulfilling and financially rewarding. And Indeed.ca states that job prospects for RMTs is very good and that more Canadians are seeking massage therapy treatment to help improve and maintain their health. They also rely on massage therapy to treat sports injuries. And then the top 10% of therapists working in massage earn more than $75,000 a year. So that sounds pretty awesome. So you too can have a thriving massage therapy business. And what I'd like you to think about focusing on is being a pain relief superhero, not settling for average, and look at boosting your earning potential. If you're at that $75,000 a year income, then great for you. I hope that I can just inspire you to see things some new and possibly better ways. And if you're not at that top of the echelon of massage therapists, then I hope to really inspire you to get there today. And also, the biggest problem I see in our industry, and the reason why so many massage therapists fail, is because they've been trained to perform a massage routine instead of a therapeutic treatment. Secret number one is really all about helping you stand out from the crowd. And what helps you stand out from the crowd is differentiating yourself from everybody else. And it's so there really is a big difference between relaxation massage and therapeutic treatment. Now, don't get me wrong, if your practice is mostly relaxation massage, that's awesome. And there's tons of people who need relaxation therapy, and that's exactly what they want. But there's also tons of people that really come to us because they want relief from their pain. And I really feel that there really needs to be a distinction between somebody who's doing relaxation massage and therapeutic massage, especially right now when our associations are trying to help us get governed under the Healthcare Professionals Act so that we're looked at as Healthcare Professionals Act, or sorry, as healthcare professionals. And a lot of the insurance companies are slashing expenditures for massage therapy because we haven't done that yet. So if you work in a province or a state where you're governed under the Healthcare Professionals Act, that's probably really helping you take your career to the next level. So we know there's a difference between relaxation, massage, and therapeutic treatment, and we need the government to understand that we are healthcare professionals. And really, we need to embrace the fact that everybody is unique. Every body and every condition is different. So it's really our jobs as therapists to approach each person and each session in a unique way. So if you become a pain relief expert, you can treat all these different problems that show up on your treatment table. I want you to take a second right now and just think in your mind or jot down, if you've got a piece of paper, how many different types of pain did you treat in the last week or in the last month? Think of all the different problems that showed up on your treatment table and all the different kind of pain patterns that we need to be able to deal with. If we're doing a recipe kind of a massage and being that cookie cutter therapist, it's often hard to give people successful outcomes if we're not providing that therapeutic treatment. So I want to kind of bring a paradigm shift to you today And to do that, take a look at doctors and how people look at doctors. So a GP, or a general practitioner doctor, sees everyone for general conditions and they get paid accordingly. Although they still get paid better than us massage therapists, but GPs are a general practitioner. They know a little about a lot of things. And then there's specialists like cardiologists and dermatologists, anesthesiologists. They know a lot about some specific things and can solve specific problems. And they earn double, if not triple, of what a GP earns. And they do have a list of clients or patients waiting to get in to see them. They're being sought out all the time because they're specialists. So that's the kind of thing that I want you to think about as a massage therapist. And it's really what secret number 1 is all about. It's the 6 inches between your ears. It's deciding not to be average, deciding to be the exception, and you will create the business and the life that you want. And bottom line, if you're not currently achieving the results that you want, the first step in creating more success is to shift that mindset and decide to do whatever it takes to be who you want to be, to have what you want to have. This is one of my favorite slides. Believe in yourself. That little kitten believes that he's that big tiger. And when you feel like you're the exception, your confidence really develops and grows, and you have to earn that confidence. And when you feel more confident, it really shifts how you see yourself. And that's really what can transform your practice and your whole life. Being the exception also really helps to boost your competence. So when you expand your massage therapy toolbox, your ability to provide more effective treatment, it also expands. So you just need to take your natural talents and develop your skills to be the best therapist that you can be. When you develop more competence, it in turn develops more confidence, and it's just a beautiful wheel that really will benefit you. And being the exception will also multiply your magnetism. So you'll automatically attract new clients. Repeat clients will refer their family and friends, and clients will just start to flow to you with ease, and so will the money. So what I encourage you today, before we move into secret number 2 and number 3, is make the decision to rise above the rest and do whatever it takes to become a therapeutic massage specialist. Don't settle for being average. Don't settle for being the same as everybody else, but become a specialist and become elite. And really everything starts by making that decision, and it's in the mindset that will shift your success in your practice and in your life. So that's your pep talk. Before we get into secret number 2 and 3, it's shift that perspective if you need to in your mind and decide to be the best. Decide to reach your true potential. Shauna is one of my students who is an absolute perfect example of what can happen in your career when you decide to do whatever it takes to achieve what you want. Shauna's taken probably every training that I've offered over the last several years, and she's a Tissue Talk Academy graduate. And she states that every client that I have had this week is amazed on how good they feel, and I'm extremely excited about what I have been feeling. You have opened my eyes so wide to a different way of approaching my treatments. Your advanced training programs have made a huge impact on my skills and what I can now offer my clients. So are you guys with me? Are you getting this? I want this to be you. I want you to feel like Shauna just stated right now. Okay, so that's your mindset pep talk for today. Take a deep breath and just take that all in. And put in the chat box, yeah, I want to be elite. I want to be the pain relief superhero and be the therapist that clients are lining up to see. Okay, who is ready for secret number 2? Secret number 2 is all about the one fundamental change that you can make to have an abundance of happy, satisfied clients and make more money. What can you focus on that is going to change your results? I really believe it's all about working smarter, not harder. And a precise and targeted skill set will decrease the strain on your body and increase the effectiveness that you have as a therapist. And also remember that you are your business. You are your most precious asset. So you really need to take care of yourself first. You need to understand how to work smarter, not harder, not only to be more effective for your clients, but to make sure that you last longer in this very physically demanding career. So, secret number 2 is all about what I call intelligent treatment. Intelligent treatment utilizes your knowledge and understanding of anatomy and physiology and pathology. It requires a much more precise and targeted treatment approach, not a recipe massage. It will yield a lot more complete and longer lasting results for your clients. Now, during this masterclass today, I want to give you an example of intelligent treatment by taking you on a tour of the neck. I want to teach you about a very challenging muscle group that requires very precise and intricate treatment. And this is a taste of what you will learn if you choose to enroll in the Tissue Talk Academy. And I'll give you tons more details about the Tissue Talk Academy as we go through this webinar. So I hope you stay around to the end. But right now, let's dive in to the neck. Okay, so neck pain and stiffness, as I said, is one of the most common problems driving people into your practice. It's often referred to as the master volume switch because it affects pain patterns everywhere else in the body. And research shows that if you deactivate problems in the cervical region, everything else responds positively. Sorry, Jasmine, I was just admitting one more person into the chat room right now. So other points of interest about the neck. Small positive changes in the neck region can make massive differences. Neck issues increase the likelihood of lower back pain by 3 times. And the lower body and pelvic imbalances cause neck imbalances to worsen because the neck is the most movable joint. Other interesting things about the neck. The neck, normal weight of your head is about 12 pounds. But for every inch that your head moves forward in front of your shoulders, that weight of your head doubles. So if you're like me looking at this image right now, you're sitting up a little straighter, and that gal on the far left, her head's going to weigh like about 42 pounds. So that is something that we don't want to have happen. Okay, so today I want to take you on a journey of what I call, or what is called, the anatomical Bermuda Triangle. And the anatomical Bermuda Triangle is, of course, the scalenes. The scalenes are a very important muscle group, and I really feel like they're overlooked and undertreated. And you really need to have a precise roadmap to navigate your way through these tissues if you want to provide effective treatment, especially when you're working with nerve entrapment issues, which I'll talk about again in a second. So let's take a journey through the anatomical Bermuda Triangle of the scalenes. First of all, anatomically, you can see that the scalenes are in between the SCM and the upper traps and the levator. So here's your SCM, if you follow my pointer here. Here's the upper traps, and then the levator right behind it, and then the scalenes are these three tiny little muscles right here. Okay, here's the levator, posterior, middle, and anterior scalenes. Very small area that they're stuck in between. They originate on the upper cervical vertebrae, the transverse processes, and then they come down and they insert on the first rib, and that's really important. We'll talk about that more in a second. And as you can see, the C5 to T1 nerve roots pass through the scalenes before they form into the brachial plexus. So there's a very tiny area with a lot of nerves and blood vessels coming between them. The other thing that's crazy about the scalenes is their referral pattern. So the scalenes can refer all the way down the front and the back of the arm. They kind of skip the elbow, and they go into the radial side of the forearm, the thumb side, and the index finger side. And they can also give you this persistent ache in your pectoral region, and also along the upper vertebral border of the scapula. And this area right here is where the scalenes are again. So a crazy referral pattern. And when your clients have active trigger points in the scalenes, this referral pattern can really be intense, especially during treatment. So it's really important that you know these referral patterns and you know how to explain this to your clients, and that by treating their neck, their scalenes, you can get rid of a lot of this pain that they are feeling in a lot of regions way removed from their neck. So really important to understand those referral patterns. And then, as I said a couple of minutes ago, the scalenes are very much involved with thoracic outlet symptoms, because the brachial plexus and the subclavian artery pass through a very small gap between the anterior scalene and the middle scalene. So you can see that if these tissues are tight, it's going to really entrap that nerve bundle. And then the posterior scalene, that's not pictured on this image right here, it can also get stuck together with the levator scapula tissues. And what happens is when they get tight, they pull up. They pull up on the first rib where they're attached. And then that can cause more thoracic outlet symptoms. And then the other thing is the pectoralis minor muscle comes up and attaches to the first rib. And when it's tight, it can pull, it can pull down on the clavicular area, and again cause more problems with the brachial plexus and the subclavian artery and veins. So there gets to be this real tug of war. And you need to understand that when the scalenes are tight, then oftentimes so is the levator and the upper traps, and all of the tissues above the clavicle pull up on the brachial plexus area, and the tissues below pull down, causing that real tug of war and increasing thoracic outlet symptoms. So the whole idea of secret number 2 is that you really need to work smarter, not harder, and up-level that scientific approach and use intelligent treatment in order to be really effective and give your clients more consistent and more complete and longer lasting results. Summary of all the different things that you have to be thinking about when you're doing intelligent treatment. It really utilizes the knowledge that you have of your muscle origins, insertions, and actions to determine the best treatment approach. Intelligent treatment is mastering how to isolate each muscle group and individual muscle fibers. And the example of the Bermuda Triangle of the scalenes shows you how important that is. It's also understanding how an agonist versus the antagonist and also how each action has synergist and stabilizing muscles, and they all work together. And we need to know which muscles work together with others so that we know what other tissues that we should be treating. For instance, in this example, was we talked about the scalenes pulling up on the clavicular area, and the pec minor would be an antagonistic muscle pulling down. So we need to know if we need to treat the scalene tissues because they're tight, causing nerve entrapment. We're also going to need to treat the antagonist, which is pec minor, and a few other things. So it's really understanding how those muscle groups work together. Intelligent treatment is also understanding the pain referral patterns. And again, I gave you a really good example of that with the scalenes. Also understanding things like fascial connections and how they affect our movement and our function. And knowing how to assess, do an assessment of function and a movement of a joint. And all the nerve innervations and all the different things that we learn from a scientific point of view. So it's the science of massage, what we know. Janine is a really good example of a person that is understanding how to use intelligent treatment and using side-lying treatment for the neck, which I'll talk to you more about in a minute here too. And Janine states that my clients are getting great results. I feel so inspired and excited to use these techniques. When I put a client in side-lying position, it is so much easier for me, and they feel the difference too. One client said to me, in 20 years of getting massage, I have never been put on my side before. She is now a repeat client, and she's feeling so much better. Thank you for your wonderful teaching skills. And so Janine was able to really perform intelligent treatment on the neck for her client by utilizing side-lying treatment, which is really effective when it comes to neck treatment. Again, more about that in a second. That secret number 1 was all about deciding not to be average, but to become the exception. Secret number 2 was all about up-leveling your scientific approach to massage. Secret number 3, who's ready for secret number 3? Drum roll, put in the chat box. I'm ready for secret number 3. Is all about the 7 keys of intuitive touch. It's all about the art of massage therapy, the highly intuitive way of communicating with and responding to the tissues. So talking to the tissues awakens the massage therapy artist within. It's this intuitiveness that is really vital to becoming an elite therapist. I really love this quote by the late, great Ida Rolf. It's not how deep you go, but how you go deep. So intuitive touch is all about, it's not how deep you go, but it's how you go deep. And this is why I came up with the whole idea of tissue talk, teaching you how to go deep. So talking to the tissues with responsive, sensitive hands. You're going to feel your way into the tissues. And then you listen to what the tissues say, and you're listening intuitively. You need to train the receptors in your hands or your elbows, whatever you're using, to pick up the information that the tissues send to you. And then you respond effectively and efficiently by applying the science, the intelligent treatment part, along with the art, or what you feel, the art part of massage. So that's how I came up with the whole idea of tissue talk. So let's get in now to these 7 keys of intuitive touch. These keys are what really help you become the massage therapy artist. So the first key of being an intuitive therapist is to invite your way in. Your hands, or whatever your palpating tool is, even if it's your elbows, should ask for permission to go in, not force your way in. You need to listen for that tissue response, and you need to try to sense what the body needs and wants. So the first key to being intuitive is inviting your way in, not forcing your way in. Key number 2 is to be very precise with your pressure. This image is one of the scalenes like we've been talking about today. And you can see how there's 3 bellies to the scalenes, the anterior, middle, and posterior scalene. And you have to know exactly where these originate and where they insert and what actions they do in order to treat them properly. So I really like to think about sliding through the fibers to investigating them, doing your detective work, and then sinking into the adhesions as you come along them. You need to ensure that you are palpating your target tissue before you start to sink deeper. So again, if you're working on the scalenes, you have to make sure that you're in the scalenes before you start to sink deeper into an adhesion that might be located in those scalenes. You need to think about that the deeper you go, the more intuitive your touch needs to be, and only go deep when you get there. You don't want to be deep along the whole muscle belly if you don't need to be. You just need to go deep into the area where the tissues are adhered. So key number 2 is being very precise and targeted with your pressure. Key number 3 is really focusing your awareness on what it is that you're feeling. Focus your awareness on what you feel. You want to feel for the tissue barrier and focus on meeting the tissues and waiting for a response. So by tissue barrier, I mean, do you feel it like it's fibrotic or adhered tissue? And then waiting for the response. Do you feel the tissue texture is changing as you palpate that tissue? Can you feel a melting or a softening of the adhered tissues? So you really have to be focused in on what it is that you are feeling. Key number 4 is be present with your client and intentional with your touch. So you not only have to focus in on what you're feeling, but you have to be present with what's going on with your body on the table, your client. Remember, it's their treatment, not yours. And you need to stay dialed in with how your client is responding to your touch. Okay, how are they responding to your touch? Can you feel pain in their tissues? Now, of course, you can't feel their pain, but as an experienced intuitive therapist, you can, quote, feel pain. You can tell when the palpation is painful for your client, and you have to stay dialed in with that so you're working within their comfort zone. You need to listen to the tissues and respond to what you are feeling. And you can't do that if you're not focused on your treatment intention. So yes, you can visit with your clients and you can do all that, but you have to be able to do that and also really stay dialed in to how your client on the table is responding. Remember, it's not a recipe treatment. It's a specific treatment for that specific person on that specific day. Okay, another one that's an obvious one, but a lot of us forget anyway, is work with the breath and at your client's pace. You only want to increase your treatment depth as your client allows you to, and you can work with the breath, and as they exhale, you can go deeper into the tissues. Key number 6 is remember it takes time for the body to change. You need to work together with your client to achieve the desired results. And to do this, you also need to educate your client about how they can take an active role in the process to get more complete and longer lasting results. And part of this is developing a treatment plan and making sure that you communicate that to your client and that both of you are on the same page and realize that it's going to take time to make some changes. And here's some of the things that you can do in order to make those changes last longer for you and be better for you. So remember, it takes time for the body to change. And then the last key, maybe my favorite, is make friends with the tissues, not enemies. Okay, remember that this is their treatment, it's not yours. You want to work within your client's comfort level and only increase your treatment depth as their body accommodates to the pressure. Okay, your receptors, your hands are picking up on the information that the tissues are telling you. And it's a win-win relationship, not divide and conquer. You're not there to show them how strong you are. You're there to help their tissues respond in the best way to what you are doing to give them more complete and longer lasting results. So work within your client's comfort level and increase as their body allows you to do that. So those are the 7 keys to being an intuitive therapist. So when you put this all together, I designed this as what I call the Tissue Talk formula. And I hope that this really resonates with you. The Tissue Talk formula is all about taking that intelligent treatment together with your intuitive touch. And that's really what allows you to have magic hands. And all of us in the biz know what people, when clients come and say, you've got magic hands, that makes us feel amazing. So it's really all about that intelligent treatment plus the intuitive touch that allows you to have those magic hands. And of course, that's what you want to have. So I hope this is making sense to you guys. And it's really my mission to empower therapists just like you to unlock your true potential and create more impact and more income than you ever thought possible. And I'd really love to help you stand out from the crowd and become the elite therapist that clients are lining up to see. The Tissue Talk Academy is really an amalgamation of everything that I've learned over my last 25 years of practicing and teaching massage. And it incorporates all the skills and the strategies that helped me to stand out from the crowd. And it's really a complete library of online training right at your fingertips. And you can even take the materials and review them right before treating a client and help you to devise a treatment plan right before that client comes into your treatment room. I think now is a really great time for you to expand your massage therapy toolbox and take your treatments to the next level. I really believe that you can really have a huge impact on the well-being of our clients and create an amazing income as a therapeutic massage provider. And that's what I'm here to help you with. So when you harness the power of the Tissue Talk formula, you're going to get time-tested, effective therapeutic techniques that will help you become an elite therapist. It's going to really improve your skills and your confidence so you can create greater client satisfaction, greater retention, and get a lot more referrals. And as a Tissue Talk expert, you will feel like an expert and your clients will treat you one. So you can stop spending your time and money looking for clients. You're going to have that lineup of clients waiting to get in to see you. You can stop working so hard. You'll understand how to work smarter and not harder. You can stop working with conditions and clients that you don't really enjoy. You don't have to be working with every client or every condition if you don't enjoy those. When you become a Tissue Talk expert, you'll be able to pick and choose a little bit. You can probably even raise your prices. Not probably, but you can raise your prices and make more money doing less treatments. You will stand out from the crowd because you provide treatment unlike any of your competitors. You will have a waiting list of happy, satisfied clients. And you will attract more of your ideal clients because you give them solutions to their problems. Here's another testimonial from one of my Tissue Talk graduates, and Robin says, using the techniques from Tissue Talk, which I affectionately call the Cheryl technique, my clients have shown great improvement, and we are thrilled. Your intuitive teaching style makes feeling the tissues easy to understand. My clients can't stop raving about the new techniques that I'm using and the results that they are getting, and I am getting tons of new referrals. So can you imagine what it would feel like if you have your clients saying these same things. I see a couple of hell yeahs in the chat box. Put hell yeah in the chat box for me. The Tissue Talk Academy is actually been growing for over 10 years. It's not something that I just came up with when COVID hit and everybody's decided to do online training. This has been a labor of love for me, and it has grown and developed over this last 10 years. And currently there's over 60 modules available. And there's presently over 100 successful Tissue Talk Academy graduates. So unlike some of the other products that you see with online training, especially, Tissue Talk Academy is kind of like Netflix for the massage therapists. You can go on and binge watch it, or you can watch 1 or 2 modules, and you can watch the modules over and over again. It's a one-stop library of techniques that you can view on your phone or your tablet, and you can take it right into the treatment room with you to practice. You get unlimited access to all existing and all new content that I continually add. So you get access to all those 60 modules, and then you get access to anything new that I put in there as well. And I'm very excited to announce that literally just in this last week, I have launched my own Tissue Talk mobile app, and this is going to allow you to actually view the Tissue Talk modules right through the app on your cell phone, and you can be reviewing them when you're in the doctor's office in the waiting room, or you could take that phone into your treatment room with you and watch the technique and then practice it on a client or a patient. Or if you want to work with another person and practice the technique. So it's going to be extremely handy having that right on your Tissue Talk mobile app. There's currently over 60 continuing education credits available if you are an MTAA affiliated therapist. And there's credits approved with the NHPC and also with Komoda. So these are just the Alberta massage therapy associations, but most massage therapy associations will give you as a therapist credits for online training. If you just look into your your association's guidelines, it'll be under something probably called self-directed study, where you can get credits with online training. So just going to take you on a brief tour of what the Tissue Talk Academy actually looks like. So all of the modules are really designed to enhance your confidence and your skill set for the 3 most common problems that usually come into our offices. And those 3 most common areas, I believe, are the neck and upper back, number 2, the shoulder complex, and number 3, the low back and hip complex. So that's what Tissue Talk is all designed to do for you. So in the neck and upper back pillar, pillar number 1, you're going to learn how to perform really intricate and precise techniques, like what we've been talking about with the scalenes. And one of the real cool things in all the pillars, but especially the neck, is how amazing it is to do side lying treatment for the neck. It really opens up the whole angle of the neck and decreases the strain on your body and allows your client to relax a lot easier. So the neck and upper back pillar is the first pillar. When you log into your Tissue Talk Academy membership, this is what it would look like. And you just scroll down any of the techniques that you want to watch. Let's say you're going to watch number 2 on the SCM. You just click on this technique and it brings up the video. And it also has a bunch of text below it that reviews the anatomy and trigger point referral patterns. So that's what it looks like inside the academy, and I can show you exactly what that looks like at the end of this. Kelly Sweet figures that Tissue Talk has been a godsend to her. She said, "I just wanted to say that the Tissue Talk Academy library has been a godsend. It works great to watch video training modules right before I'm going in to treat a client with a specific problem or a complaint. And this is what I've heard actually from a lot of the Tissue Talk members, is that they really enjoy watching a specific training module. If they know they have a client coming in that has, like today's example, thoracic outlet syndrome, they'll go in and watch all the videos associated with effectively treating thoracic outlet before the client comes, to give them a quick review of what it is that they should be doing with them. So it works really good to take these videos right into your treatment room with you. So the second pillar is the shoulder rotator cuff pillar. And we all know that the shoulder is also a very common problem that you see in your clinics. And it's really one of the most challenging joints to treat because it's such an unstable ball and socket joint that is kind of held together with the tendons and the ligaments. It's not like the hip joint where the femur is in a really deep socket in the acetabulum. With the shoulder, the head of the humerus is just kind of hanging in the glenoid fossa, and it's stabilized with all the muscle and tendon attachments. So it can be quite a challenging joint to treat. But in the modules, we talk a lot about how functional movement of the shoulder requires balance between movement of the scapula and movement of the glenohumeral joint. And we look into assessment of the shoulder and look at all the rotator cuff muscles and understand that with the shoulder, the most important thing is that we need to get it moving or keep it moving, and that motion heals. So here are some of the examples of the modules that are located in the shoulder module, or the shoulder pillar. And then the third advanced technique pillar is all, of course, lower back and hip problems, because that's the third most important or most common thing that we see in our practices all the time. So again, you're going to learn how to isolate and treat all of the lumbar spine and pelvic muscles. And one of the things that I really focus on is treatment for the iliopsoas complex, or the hip flexors. And you can see that pictured on this image here. The psoas is pictured in red there, running from T12 down towards the iliac crest. And most people that have lower back pain have tight hip flexors, and they also commonly have weak extensors. So we talk about how to create more balance by lengthening the hip flexors and strengthening the hip extensors. And we learn a lot about different assessments and corrections to correct common pelvic imbalances, like high ilium correction and things like pubic symphysis dysfunctions and that kind of thing, SI joints dysfunctions. So again, here's some of the different videos, modules that are in the lower back. And all you do is you go into your, log into your Tissue Talk Academy site, and you just click on the video. And if you want to watch the high ilium video, you just click on that and it loads and off you go. Easy and as simple as that. More Tissue Talk graduates, and Michelle states that I refer to the Tissue Talk videos more than any other resource that I have. The entire Tissue Talk Academy is great, and each of the 3 advanced technique pillars is packed full of everything from new techniques, exercises, anatomy review, and assessments. These are by far the best massage therapy programs that I've ever taken. And then I'm not even finished yet. So there's the 3 advanced technique pillars. And then pillar number 4 is all of the rehabilitative exercise modules. And especially with my physical education background, I think it's really important that we teach our clients how to do the proper lengthening and strengthening exercises. This is a really good example of a stretch that is often done improperly. a lunge stretch for the hip flexors. A lot of times people will not do a posterior tilt first before they go into a lunge, and they let their pelvis just go into an anterior tilt with an excessive lordotic curve, and it actually can make their back problems worse because they're allowing their pelvis to just go into that anterior tilt. So with a properly done hip flexor lunge stretch, you want to go into a posterior tilt first before you go into that lunge. So you can teach your clients how to do these exercises, and you should be doing all of these for yourself and make sure that you know how to do them so that you can properly teach them to your clients. So that's pillar number 4 in the Tissue Talk Academy. And then I'm still not done. So as I said, I think a lot of therapists have a lot of don't have much experience with business strategies. So I've added a whole section of business strategies in here as well. And bottom line, everything your client sees, hears, and experiences is going to impact your business. And you need to learn marketing and business skills that will help you create a profitable and sustainable practice, and skills that will help you attract your ideal clients, and things like techniques to make sure that you're decreasing your no-shows and creating more client satisfaction. So pillar number 5 in the Tissue Talk Academy is all about business strategies for the massage therapist. So how is it looking so far? Put in the chat box. This looks awesome. Okay. So, oh, and then the next pillar. Almost forgot about this pillar. So there's also pillar number 6 is all on the 6 inches between your ears, a success mindset for the massage therapist. Talks about really embracing possibilities that arise and being open and alert to changing situations, having confidence, and being flexible in your response to change, like we had to going through this COVID. And talks a lot about present-minded awareness, being able to stop your thinking and examine, should I go right or should I go left? So the whole idea of stop, look, and choose which direction you want to go or which decision you want to make by being in the present. So that's pillar number 6, success mindset strategies for the massage therapist. Okay, so let's take a look at everything included in the Tissue Talk Academy all together. So 6 pillars. The first 3 pillars are all of the advanced techniques for the neck and upper back, the shoulder complex, and the lower back and hip. Pillar number 4 is all of the rehab exercise modules. Pillar number 5, that's supposed to be, is the business strategies for the massage therapist. And pillar number 6, those success mindset strategies. So you're probably wondering what all of this is worth. All of these 6 pillars of the Tissue Talk Academy. Well, the first thing that I'd like to say is that many of my Academy students have doubled and even tripled their income and their clientele after developing their Tissue Talk skills. So I can't tell you exactly what Tissue Talk is going to do for you because I don't know you yet, but I do know that it's done this for many of my students. Shauna, who I introduced you to a little bit earlier in the masterclass, states that her clientele has tripled. And ever since she took the first course with me, her clientele has tripled and it keeps building. I can't thank you enough for what you've done for me and my clients. So Shauna, when she first decided to do some training with me, she was struggling with having that steady list of clients and really building her practice, but now she has tripled her clientele and it keeps on building. So Can you imagine what it would be like if this was your results and this is what I want for you? This really can be for you too. And Teresa states that she insists my therapists are Tissue Talk certified. I have used the techniques that you teach and they work wonders. If I were to hire any other therapist at my clinic, I would insist that they have certificates from Tissue Talk. That would ensure me that they are serious about their work and that they have been taught valuable therapeutic techniques. So thanks, Teresa, for that testimonial. Okay, so what is all of this worth? Well, let me explain the breakdown for you. So the first three pillars, all the advanced techniques, have a value of $997. The exercise modules have a value of $997. The business strategies and the success mindset strategies also have a value of $497. So the total of all of that is a value of almost $5,000. However, I'm not going to charge you $5,000. I've bundled them all together so I can offer you all the pillars for only $1997. How does that sound? Okay, and that sounds a lot better than almost $5,000. And then what else can I do for you to make the value even greater? Well, you will also get PDF copies of the advanced technique manuals for the neck and upper back, the shoulder, and the low back and hip. And these manuals will give you instructions that will guide you through all of the different techniques, just like the videos do. And they also give you anatomical overviews and trigger point referral patterns. So when we add in that bonus of the technique manuals, the total now is over $5,000 and it's only $1997. I know that this is totally a value of $1997, but I also know that I've been where you are, and it's sometimes hard to commit to investing in yourself because you have lots of other expenses too. So I'm not even going to charge you this $1997. But if all this did was give you proven effective therapeutic techniques and that you could implement right now into your treatment protocol, do you think that a one-time payment of $1997 would be worth it? Or if all this did was boost your confidence so you feel like an expert, do you think a one-time payment of $1997 would be worth it? Or if all this did was reduce the strain on your body and increase the longevity of your career, do you think a one-time payment of $1997 would be worth it? So remember, this isn't just about you. This is about the ripple effect that you will create, the impact you will have on your clients' lives, the positive change that this will create for your life and your family, and also the difference it's going to make to your bank account. Teresa Leonard-Duzzi states that you're really missing out if you don't enroll, that this training is a must-have. If you are a serious massage therapist, contact Cheryl for information about her online training called the Tissue Talk Academy. So let's just take a moment, and I want you to picture yourself right now. Take a deep breath. Picture yourself right now as the expert, gifted therapist that everybody is lining up to see. What would it feel like if you were able to work with your ideal clients? What would it feel like to be able to work with your ideal clients? What would it be like if you could raise your prices and actually do less treatments and make more money? What would that feel like? So, as I said, I have no doubt that this training is worth $19.97, but because you're here on the webinar today, I want to show you what I'm going to do for you. So here's everything that's included in the Tissue Talk Academy, with the bonus of the PDFs of the advanced technique manuals, well over $5,000 in value, priced at $19.97 because I've bundled them all together. But because you're here on this webinar today, and I want to make it as easy as possible for you to take action now, to do this right now, I want to offer you this entire Tissue Talk Academy bundle package for only $9.97. Okay, so that's well over a $5,000 value for only $9.97. That's what I want to do for you today because you're here on this webinar with me. Now, you're still here on this webinar, so you must realize that you want something to change in your life and in your practice. So it's probably a good time to take action. Or maybe you're just needing some inspiration because you've been practicing for a while and you're feeling a little bit stagnant and you just need some new inspiration. Or maybe you feel like you just need a little bit more confidence to step outside of your comfort zone and really create the kind of practice that you want, the practice of your dreams. So wherever you are in your massage therapy career right now, I'm really confident that the Tissue Talk Academy can help you take your practice and your life to that next level. So when you enroll in the Tissue Talk Academy, you're going to get immediate access to all the present content that's in the Academy. And there's like over 60 modules in there right now. And you're going to also get access to all new content that I continually put in there. This is unlimited access. There's no expiry date, and you can use the training over and over and over again. And I also have something very exciting coming real soon, like within the next couple of weeks. I have decided to create my own Tissue Talk Academy app on your mobile phone, an app for your mobile phone, and very soon you are going to be able to access all your Tissue Talk Academy right from your mobile phone on that app, which is going to be very cool. I'm very excited about that. It's really important that you take action now and take your career to that next level. And I know how hard it can be to make it on your own. So there's one more friggin' amazing bonus that I want to offer you today. I want to offer you something that most online programs do not offer, and that's my personal support and guidance through the program. So if you decide to take action and invest in the Tissue Talk Academy today, this is a 24-hour limited bonus. You are also going to get 4 virtual group coaching sessions with me. And I want to make sure that you get massive value from all this training. And I want to be able to do live reviews of some of the Tissue Talk modules with you. I want you to have access to me. And I've been where you are. I understand where you are. I understand your problems, and I can help you find solutions to those problems. And I want you to have the opportunity to ask me questions live and to connect with me personally, and also to connect with other like-minded Tissue Talk Academy members and other elite business owners. So what this involves is during the first 4 months of your Tissue Talk membership, you get to come to one of these virtual coaching sessions, and they are right now scheduled for the 4th Wednesday of every month at 10 a.m. Mountain Standard Time. So this is a huge bonus that I am really excited to be able to give you, because I really want to connect with you personally and make sure that you get the most success that you can out of your investment in the Tissue Talk Academy. And I really want to help you succeed. I want to be able to give you one of these certificates, put your name right there where it says Magic Hands, so that you can submit this to your Massage Therapy Association and get credits. So when we add this virtual coaching bonus in, remember this is for the next 24 hours, and we put that into the total bundle, the whole bundle now that I'm offering you is almost a $6,000 value. And remember, you're getting it today on this webinar, including this bonus if you act within the next 24 hours for only $9.97. How does that sound? I want to leave you with this final quote, and then I'll answer. Please stay on the line if you have any questions. Don't go anywhere. And I also have a little gift for you at the end. But Susan Lavery states that I'm really enjoying your videos and can't wait to practice the techniques. I love your teaching style and the great camera angles. And I hope to meet you one day, but in the meantime, this will be perfect. You are such a great educator, and I'm so happy that I found you. So let's just think about it. If you're still trying to figure this out in your brain, and can I do this? Well, how many treatments would you have to do to cover your cost of Tissue Talk? This is just an example. Let's say you do 4 treatments per day. So that would be 20 treatments per week. And let's say that you earn $50 per treatment. You could earn a lot more, you could earn less. But if you are someone who's doing 4 treatments per day, 20 treatments per week at about $50 per treatment, that means you're making about $1,000 a week. So all it would take would be 1 week for you to cover your costs of the Tissue Talk Academy. So I know you need to believe in yourself, and your future is worth this investment. And I also understand that this is a big decision for you, but I also know that the reason that I had such an awesome journey in my massage therapy career is because I decided early on in my career to invest in myself so that I could grow and thrive, and that's exactly what I did. So I encourage you to activate your choice muscle. Of course, you have 2 choices. One choice is to do nothing, but you've made it this far in the webinar today, and if you do nothing, probably the results that you're getting in your career will not change. So I don't know, how would you feel right now after listening to this presentation today if you decide to do nothing, if you decide not to invest in the Tissue Talk Academy? Are you going to feel disappointed, or are you going to be okay with that choice? So, of course, the other choice is to activate your choice muscle and decide to invest in the Tissue Talk Academy today. So I don't know you yet, so I can't tell you exactly what the Tissue Talk training will do for you, but I can tell you that it's helped hundreds of therapists to fill their appointment book with ease and create a very thriving and profitable practice. And I want that for you too. And so I really encourage you today to set your intention to take action now and start moving towards the career and the change that you want to make. Knowledge is power, and applied knowledge is very powerful. And when you advance your knowledge, it's also going to advance the power that you have as a professional and to take your career just that much further. As a Tissue Talk expert, I know that you can create your future and live your dreams and make the impact and income that you desire and deserve. One more testimonial from Shirley Harrison from Yellowknife. She states that you are a really good teacher, and I use your techniques all the time with great results. I have taken other courses that were mostly marketing scams, all hype and very little substance. The Tissue Talk Academy is amazing value, and you are the teacher I wish I would have had in massage school. So bottom line, today's the first day of the rest of your life, as they say. So all you need to do to get started is go to tissuetalk1.com/start now. And if you're watching a recording of this, you can probably see a button down below. So tissuetalk1.com/start now. Just to give you a recap of all of the pillars involved in the Tissue Talk Academy for the special webinar price of $9.97. When you add up all of the different pillars, plus the bonus of the Advanced Technique Manual PDFs and the 4 virtual coaching sessions, it's a value of almost $6,000, and it's yours today for only $9.97. The other things that I haven't mentioned is that there's also a Tissue Talk Facebook page and a Tissue Talk Academy Facebook group, a private group. And I really encourage you, when you become a member, to become a member of the Academy group and become one of the Tissue Talk tribe. It's really starting to grow, and it's been awesome for therapists to be able to connect with each other. So again, the Tissue Talk Academy special is for only $9.97, and you need to go to tissuetalk1.com/start now. If you are on this, and if you are watching this webinar as a recording, you're probably going to see a button down below, and you can just click on that button. It's tissuetalk1.com/start now. If you're on the webinar live with me, please stay online, and I will answer any and all of your questions. And before we go, I am just going to stop my share and say hi. Hi, everybody. How you doing? I'm so happy that you joined me. I feel blessed to be able to present this to you today, and I thank you so much for coming. And I would just like to share my screen one more time and show you the Tissue Talk Academy registration page. And you should be able to see that now on your screen. So it's tissuetalk1.com/start now. You'll see a little video here that you can play, and then you can actually do a one-time payment of $9.97, or you can choose the 3-month payment plan that you make 3 equal monthly payments. And there is also a $97 a month payment plan if that's what you need in order to take action today. So if you'll notice here also, there is a money back guarantee if you get Tissue Talk Academy and just decide that it's not anything close to what I promised it was going to be, then there is a 30-day money-back guarantee. That's never happened before, but I just want you to know that this is a no-risk policy. So again, thank you so much for attending today's webinar. I really appreciate you showing up, and I feel really blessed to be able to present this information to you today. If you're watching the replay, you probably see a button down below you to register. You can choose a pay in full, $9.97 plus the GST if you're Canadian, or you can choose a 3 or 12-month payment plan. So I really hope that you can jump on board today and take advantage of this 24-hour bonus. And again, I really want to thank you for being here. So my name is Cheryl Stevenson. My company is Perfect Balance, and this is the Tissue Talk Academy. Have a great day and live to your edges. Bye for now. Okay, can you see my website now, you guys? Just give me a wave. Okay, Anna was wanting to look at the low back. So this is what the website looks like. See how when I hover over all of these categories, here's the low back pillars, here's the neck and upper back, here's the shoulder, over here is the biz tips and the self-help. And then under each one, there's techniques and also the rehab exercises. So right now in the low back one, there's 13 different techniques. So is there a particular technique that you want to see? How about if I just pick one? That's way too many questions for you.
Sure. So let's QL. Let's do QL.
QL, okay.
Thank you.
No problem. So you just click on that one, and then you'll see here that it has all sorts of notes underneath. that takes you through some of the anatomy and oftentimes the trigger point referral patterns. So it's got all of that there for you. And all you do is click the button and hope your internet is working. And it loaded really quick here, so that's awesome. Hello, and welcome to this month's edition of Tissue Talk. So you'll see many different hairdos, and I'll look a little bit different because it's been 10 years that I've been doing this. So you'll see me at lots of different stages of my life. So I'm going to play this, and I'm also going to put it on full screen so you can see it a little bit bigger. So right now you have the ability to watch this on your desktop or your laptop. And when I get this app completed, which hopefully will be in the next couple of weeks, it's just being launched. There's going to be a Tissue Talk app right on your phone that you can have access to this through your app, which is going to be friggin' amazing. So almost all of the QL is underneath this paraspinal muscle mass, which will be wider on some individuals than on others, depending on their surface anatomy. That we investigate the tissues along the iliac crest, right through the middle of the muscle belly, and also right up underneath the 12th rib where they attach. The type of motion is a downwards and inward motion, down to the table and in towards the spine. If we just go on top, we are going to be more through the paraspinal. So we have to get in underneath that paraspinal muscle mass and go down and in towards the table. So I can tell just by investigating Val's tissues here that she's got quite a thickness through her QL right in the middle here. So I'm just going to slide slowly into the tissues. I'll get this hand out of the way for you. And I can feel that thickened tissue there. Now I can put my other thumb on top and I can do some trigger pointing just by applying pressure and doing a little bit of a rocking motion until I feel those tissues start to loosen a little bit. And I can be asking the patient if they're having pain referral, how much it's hurting on a scale of 1 to 10. So again, it's just really important. Okay, so again, I talk a lot about how to access the tissues and that the pressure has to be down and in towards the spine in order to get to the QLs. It exposes the QLs a little bit better than in the prone position for some patients. So the most important thing is to get them in a proper position. The bottom leg is bent so that they just feel supported and comfortable. The top leg is straight and slightly extended if you want to, but just in a position that they are comfortable. The top arm is going to be elevated above the body so that you can really open up this area from the top of the iliac crest to the 12th rib. And you can place a rolled up pillow underneath their back, basically to really try to open up the rib cage. If the arm is down here, it doesn't open up this area as much as if we raise the arm up overhead. That raises the rib cage and really gives us access through where the QL muscles dive underneath the paraspinal muscles. Now, just to landmark the tissues again, we're going to come along the top of the iliac crest. And again, here's the whole paraspinal muscle mass, and we want to get in underneath that paraspinal muscle mass down towards the spine. The middle part of the QL is the easiest to access here, and the upper part of the QL. So I've got my thumb right on Val's 12th rib. So basically just a small area here where we can access the QL fibers. So what we're going to do is, again, landmark from the ilium, crest of the ilium to the 12th rib, slide underneath the paraspinal muscle mass and pressure down towards the table, diving just underneath the paraspinals. So I'm just sliding and sinking. And I'm going to apply pressure with the other hand now so that I can use the top thumb as a brace. And then we can do a very effective active release technique. So again, I can start medially and roll over the paraspinal muscle mass, or I can start laterally and roll underneath the paraspinal muscle mass to find that adhesion in the QLs. I'm going to see if I can find the worst one to pick on here. One thumb over the other to brace. And then Val, a little bit of a hip hike, and then relax. Just relax for a second. As soon as I get Val to do that hip hike, I can feel the tissues pop right up underneath my thumb. So that you can be confident that you're landmarked properly. So pin the tissues, Val, a little hip hike. Good. And then stretch your leg out and reach with your upper arm too. Reach, 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 reach. And relax. And then okay, so pin and stretch can be so effective with so many different tissues, and basically you get them, like, because the QLs are hip hikers. If when they hike their hip, then that activates the tissue and you can make sure that you're landmarked properly. And then when they stretch their leg and their arm away, that puts the tissues on stretch. So how's that for you?
That's amazing. Thank you for sharing. Thank you.